Part 4 of JEPBN 2021. Must watch the video. Pathological compulsion to steal is known as kleptomania, hypomania, impaired judgment, intoxication. Right answer option A, kleptomania. Next, which of the following blood tests should be performed before a blood transfusion? Option: prothrombin and coagulation time, blood typing and cross matching, bleeding and clotting time, complete blood count and electrolyte level. Right answer option B, blood typing and cross matching. Most common cause of maternal mortality in India. Option: infection, hemorrhage, hypertension, thrombosis. Right answer option B, hemorrhage. Next, which of the following is most specific of psychosis? Option: pressure of speech, neologism, incoherence, preservation. Right answer option B, neologism. Next, who collaborates directly with the client to establish and implement a plan of care? Primary nurse, nurse clinician, clinical specialist, nurse coordinator. Right answer option A, primary nurse. Next, which among the following is not a complication of twin pregnancy? Option: low birth weight, post maturity, abortion, chromosomal abnormality. Right answer option B, post maturity. Next, neural tube defect can be prevented by administering option: prenatal folic acid, antenatal phenobarbital, postnatal folic acid therapy, none of the above. Right answer option A, prenatal folic acid. Next, the prognosis for patient with shock depend on the following factor except option: the type of shock, the cause of shock, the length of the shock state, pre-existing patient factor. Right answer option B, the cause of shock. Next, following are the nursing intervention for the patient at risk for injury from low red blood cell count except option: avoid prolonged tourniquet use, elevate the patient head on pillows for shortness of breath, allow for rest between period of activity, provide extra blanket if the patient feel too cold. Please comment the right answer. Next, which of the following developmental milestone is expected from a 2-year-old child? Option: use a spoon to eat, use a cup to drink, use a knife for cutting food, pour milk into a cup. Right answer option B, use a cup to drink. Highest diameter of fetal skull is option: mentovertical, submentovertical, suboccipitopegmatic, submentobregmatic. Right answer option A, mentovertical. Next, most common side effect of IUCD use is ectopic pregnancy, uterine rupture, excessive menstrual flow, expulsion of IUCD. Right answer option C, excessive menstrual flow. As defined by Freud, the ego is that part of the mind that contains option: the basic instinct and urge, the conscience, the ability to respond to the realities of everyday life, all element of the holistic person. Right answer option C, the ability to respond to the realities of everyday life. Tetralogy of Fallot is characterized by. Right answer option A, pulmonary stenosis, VSD, overriding of aorta, right ventricular hypertrophy. Which of the following statement about chest X-ray is false? Option: before the procedure, the patient should remove all jewelry, metallic object, and buttons above the waist. Next, a signed consent is not required. Eating, drinking, and medication are allowed before this test. No contraindication exists for this test. Right answer option D, no contraindication exists for this test. Next, psychosocial theory is propounded by Sigmund Freud, Erik Erikson, Jean Piaget, none of these. Right answer option B, Erik Erikson. Next, midday meal program was started in India 1961, 1981, 1999, 2001. Right answer option A, 1961. Actually, it is 1995 officially. The umbilical cord contains following blood vessel. Option: 2 arteries, 1 vein, 1 artery, 1 vein, 2 vein, 1 artery, 2 vein only. Right answer option A, 2 arteries and 1 vein. Living standard of people is best assessed by option: IMR, MMR, physical quality of life index, death rate. Right answer option C, physical quality of life index. The major contribution in amniotic fluid is by fetal urine, fetal plasma, mother's urine. Right answer option A, fetal's urine. Biomedical concept of health is based on option: germ theory of disease, absence of pain, social and psychological factor, equilibrium between man and environment. Right answer option A, germ theory of disease. the type of play a toddler is engaged in. Option solitary play, cooperative play, parallel play, group play. Right answer option C, parallel play. A high pitched cry is seen in hunger, anger, maternal deprivation, intracranial tension. Right answer option D, intracranial tension. Which of the following is a sign or symptom of a hemolytic reaction to blood transfusion? Option hemoglobinuria, chest pain, urticaria, distended neck vein. Right answer option C, urticaria. Next, the two blood vessels most commonly used for TPN infusion are the option subclavian and jugular vein, brachial and subclavian vein, femoral and subclavian vein, brachial and femoral vein. Right answer option A, subclavian and jugular vein. Next, a patient who refused to take bath stating that water and soap are poison is a typical example of right option suicidal ideation, delusion, negativism, hallucination. Right answer option B, delusion. Delusion means false, fixed and unshakable belief. 50% glucose and regular insulin is used for the management of hyperkalemia because it option stabilize the irritability of cardiac muscle, improve metabolic acidosis, transport potassium from extracellular to intracellular compartment, bind the potassium ion for excretion in the feces. Right answer option C, transport potassium from extracellular to intracellular compartment. Next, lifespan of fetal RBC. Option 50 days, 80 days, 100 days, 120 days. Right answer option B, 80 days. Next, early breast cancer detection in asymptomatic individual above 40 years of age include option clinical based examination by health professional every 3 years interval, annual mammogram, annual pap test, endometrial biopsy. Right answer option B, annual mammogram. Next, by which the effectiveness of nurse client communication is best validated. Option client feedback, medical assessment, health team conference, client's physiological adaptation. Right answer option A, client feedback. Next, unconscious defense mechanism in which the person undergoes a partial or total return to earlier pattern for adaptation is known as option regression, repression, reaction formation, perception. Please comment the right answer.